First of all, welcome and thank you so much for joining us at the Omaha Downtown Improvement District Annual Security Forum. My name is Holly Barrett. I'm the Executive Director, and I'm joined here by a pretty spectacular team. First and foremost is my Communications Director. Calvin, you can go ahead and turn your camera off at this point. We'll pull you on in a sec. Christina Randall is our Communications Director. She is the main person that you hear from. She's also the person that puts out all of our promotions for events and news and interesting things. She's also the front line if you ever call the office and have a question or you're seeing an issue or something like that you're trying to get through to us. So I also am joined by Tim Malik, who is from First National Bank. Tim is on our board. He is the representative for one of our top 5 largest properties in downtown. He's also the chair of our security forum and has been doing that for us for a couple of years. He's really fantastic. We also have Calvin Jones, who heads up Lionsgate Security, which is our private security team that works with us. We'll talk about that in a few more minutes. And then, of course, we have our presenters, and I'm going to present, or I'm going to present them. I'm going to introduce them in just a few minutes. We've got about 40 people with us right now, and we are going to see about 60 folks coming in. If you have questions, please put them in the chat or the questions and answers section. There have been a number of really fantastic questions that were submitted through the registration process. And when we get to the question and answers part, we're going to hold questions until we get to that point. But when we get there, we're going to start with those. And once we get through there, then we're going to open it up to anybody else. But as you have questions coming up, go ahead and put them in there so that Christina can be tracking them for that time.
And yes, the chat is disabled. Just the Q&A. There's a little box at the bottom of your screen that you can type those in.
Perfect. Thank you so much, Christina, for clarifying that. So go ahead and put it in the questions and answers if you have a question as we are going along. Christina, could you go to the next slide? Real quick, I just want to give a quick introduction. Oh, I'm sorry, you can go to the next slide after that. I want to give a quick 10,000-foot view of what the Omaha Downtown Improvement does. We are funded entirely by property assessments, which are paid to us through an ordinance. All of you pay on a sliding scale depending on what kind of property owner you are, and that depends on how you participate. All of those funds go right back into our programs. We have 4 main mission statements: clean, green, safe, and active. Every improvement district around the world has those 4 basic tenets, and then all of their programs are built into that. So our budget is about $600,000 a year. It's not a lot. It's not enough, but it pays for 4 to 5 full-time clean and green team employees. They're on 365 days a year, and they do everything from picking up the cigarette butts and to the major litter, picking up things, major messes that we find, you know, the messes that pigeons are making, all that kind of stuff. In addition to planting all of the beautiful flowers and plants that we have around town and taking care of all of the trees. It is a very small team, and we love working with property owners directly. If they've got an idea of something they want to do on their property, we will try to make it happen, or we will work with them to make whatever they've got going on working really, really well. We are very reactive. So if you have come across an issue that is not something on our normal route or we haven't picked it up, just call the office and let us know, and we can get out there. We can put a work detail out there for that day. The third tenet in our mission is our activation arm. And that is part of what this program that we're going to be talking about tonight is. All of the people that are out on the street, how do we get them out there? How do we keep them out there? Everything from passive activation, meaning reasons to stay, beautiful art to look at, places to sit, clean spaces, and safe spaces that feel good that you want to come into. This is also where we do a lot of advocacy and promotions and things like that. But the real program that we're going to be talking about tonight is our security program. So our security program is a twofold. Number one, we provide a private security team. We work with Lionsgate Security, and we're going to talk a little bit about exactly what they do. I believe that we are also joined tonight by our actual Lionsgate officers, and that's Dawn Dooling and Matt Ricks. These guys are, and we also have other officers, but these are our regular guys. And a lot of you, especially if you are small business owners, have met them personally because they go in, they say hello, they find out what's going on. These are the guys that if you see them out there walking around, more than welcome to stop them and ask some questions. The picture in the bottom that you are seeing is what our guys look like in their year-round uniforms. They're black uniforms with a big badge. Our officers are unarmed. Their main goal is to enforce good neighbor rules. Things like somebody is misbehaving on the sidewalk, they're going to ask them to move along. A busker that is performing with an amplifier, which is illegal in the historic district, they'll ask them to move along. And then they are the eyes. Something is happening and they quickly call the police if it's going to be escalating out of their control. So these guys are really, really helpful and they're really nice. We've got several different shifts. We try to have an officer on at any given time on Monday through Friday, or I'm sorry, Monday through Sunday, depending on when the highest volumes are down here and when we see the issues. So for the most part, we have an officer on Monday through Wednesday from 4 to 10, Thursday through Saturday from 7 p.m. to 3 a.m., an extra officer coming on from 11 p.m. and they stay on until 7 p.m. And then on Sundays, we have an officer out from 3 p.m. to 11 p.m. We also work very closely with the Omaha Police Department. We've also have a couple of officers with us tonight, including our Riverfront Patrol Sergeant. These officers, they can answer this better than I, but at any given time, there are about 11 to 13 officers, depending on what's going on, what time of year. And in June, we add to the pool by hiring off-duty officers that get added into the Riverfront Patrol, and they can get put wherever the sergeant feels like they need to be most useful. So those come on in June. They're anywhere from 2 to 6 officers that we bring on, depending on the availability. And then we also bring on an extra Lionsgate officer on Friday and Saturday nights from 9 a.m. to 3 a.m. And that's during the month of June when we have College World Series, all of the major events. It's finally warm and everybody's coming out. We jokingly call it the drinking season. We also have an escort service, and everybody always laughs when I say that, but the truth is, sometimes we have some late night employees that are uncomfortable walking to their car. Sometimes we have just maybe it's a group of ladies who are going to be walking several blocks to get to their parking lot. This escort service, they can call and our Lionsgate officer will come meet them and walk them right to their vehicle so that they feel very safe. Again, that is something that it's hard to get the information out. So I'm glad that you're all here tonight and hearing about that directly from us. Let's see, Christina, did I forget anything there? I don't think I have.
No.
We are going to talk right now. We're going to move right into some conversations about what the police department does and what the homeless service providers are doing for us out here. Our speakers tonight are Tamera Dwyer, who is our City of Omaha Homeless Services Coordinator. This is a brand new position. This is something that the mayor's office is really focusing on. Tamera works right in her office. So that's a clear indicator that she is absolutely paying attention to this and focusing on it. Tamera's worked in the homeless services area for 10 years in various roles. She's currently our mayor's office homeless services coordinator. Along the years of experience in this work, she's a master level social worker. She brings to the table her own lived experience in homelessness and housing instability, so she really understands the complexities that are always involved. She's going to be talking to us about some major numbers and stats and some of the day-to-day things that she does working with outreach officers. Then we are also joined by Lindsay Kroll, who is the mental health coordinator with the Omaha Police Department. She oversees various mental health related initiatives, and she supervises the co-responder program, which she's going to get into in detail when we start talking. Lindsay's a licensed independent mental health practitioner. She's got 17 years experience in behavioral health and criminal justice fields. So we are really happy to have these two amazing speakers with us tonight. And then we do, as I have alluded to, we have a whole group of other experts that we work with regularly and that these two ladies also work with regularly. So when we get into that questions and answers, if there's some specifics that they would like to chime in on, we will pull them into the mix. At this point, I think let's go ahead, Christina, and turn it over to Tamera and Lindsay, who have put together a joint presentation, which I'm really excited about because these are issues that go hand in hand.
Yes, thank you, Holly. Thanks for inviting me and Lindsay. We kind of work together and put something together for everyone. Like Holly mentioned, I'll start and just go through kind of statistically what homelessness looks like in Omaha, a few things that I have been working on in the mayor's office, and some things I have in the works. And then Lindsay will take over with her additions on our presentation here. Let me share my screen. Okay. Can everyone see that okay? We're good. Okay. All right. So in my role as a homeless services coordinator, since I started in December up to now, I've met with roughly about 50 different community organizations, all of the different city departments, several state and county agencies, groups, many different advocacy groups, and national partners that are working within homelessness. Some focus areas that I've developed with the mayor and other staff in her office, listed kind of here. She wants to get the homeless task force on a path of setting some goals strategically, some long-term goals with a broader vision of homelessness.
Hey, Tamera, sorry to interrupt you, but we are just seeing a black screen that says loading.
Let me see.
You want me to try to share my screen? I can see if.
Yes, maybe. It says my screen is paused. Let me see how I can fix that.
We love technology.
Stop sharing it. Sorry, I don't know why it was paused.
You want me to try?
Yeah. Do you have the presentation?
Yeah. I don't know. Can anybody see it?
Yep.
Okay.
Perfect. All right.
Okay.
Oh, all right. Well, we're on the next slide. There we go. Okay. Sorry about that, everyone. So as I was saying, some of the different focus areas, leading and developing city processes for responding to encampments, including all of the different departments within the city, some county departments, and several community organizations to respond to unsheltered homelessness. So folks living on the streets and encampments specifically. Strengthening collaboration between the city of Omaha and the collaborative street outreach that has been in existence for well over a decade, and providing some training and education opportunities for anyone that is interested. I've met with several different businesses and groups throughout the city. We also have a focus to end veteran homelessness. And you'll see further on that it's getting pretty close. Our numbers are consistently decreasing within veteran homelessness, and I've been a part of that work for a few years now. And also creating a community plan for disaster condemnation that leaves several community members without a home. For example, like when Legacy Crossing happened, there was several organizations and community members that wanted to participate in contingency plan of that sort. You can go to the next slide. So this is the point in time data from 2022. What the point in time count is an annual count that is mandated by HUD. Each community has to do every single year in the end of January, the last 10 days of January. Nebraska does a statewide point in time count. So all of the areas in Nebraska do it on the same day together. What it is intended to do is like a snapshot of on any given day in your community. This would be how many people typically experience homelessness. So in 2022, we could estimate 1,346 experience homelessness in Omaha. And it's up from the previous year, as you can see with that 5-year chart there. That also takes into account the dip in 2021. Towards the end of 2020, 2021, the shelters had to decrease their capacity due to regulations from the health department. So we could contribute that to some of it, and also some housing programs were increasing their capacity with some extra COVID funds in the community. So you can see we had last year 161 that were reported to be unsheltered homelessness, so living on the streets, living in their car or another place not meant for habitation, like a abandoned building or something like that. And 1,010 folks were in emergency shelter. And it's a 0 in safe haven. And that is because we used to have safe haven beds, and we no longer have safe haven beds. They were funded through the VA, and we just no longer have those beds in our community. You can go ahead and go to the next slide. All right, this is the last permanent zip code. So a data point that HUD has programs collect is asking folks what was their last permanent zip code, their last permanent address. So as you can see, majority of folks had an Omaha zip code. There are some folks that had Council Bluffs zip code at 26%. And then 2.5 had a zip code from the metro area other than Omaha Council Bluffs. So that could be Bellevue, Sarpy County, those kinds of things. And then there was a 9.3% that left that unanswered. I get the question a lot about transient homelessness or people coming from other communities. So I always think this is an important thing to present to everyone. You can go to the next bit. Thank you. Chronic homelessness in our community. Last year, we had 400 chronic homelessness, 400 people that were experiencing chronic homelessness. That has continuously went up in our community, of course, except for 2021. And the number of unsheltered chronically homeless folks was 94. 306 were in emergency shelter, as it says there. Chronically homeless, just to define that a little bit for you all, is someone who experiences 12 consecutive months of homelessness, or three or more occurrences of homelessness in a 3-year time span that equal to 12 months or more, and also have a disabling condition. So they have to have that length of time homeless and then also a disabling condition, and then they would be considered chronically homeless. The reason we think this is going up is, of course, because people are not able to access housing programs. There's not enough housing, affordable, safe housing in the community. So that just lengthens people's time homeless. For veterans, last year we had 91 total veterans that were experiencing homelessness in our community. 26 were in a transitional housing program, 64 were in emergency shelter, and 1 was unsheltered. Transitional housing programs can be a treatment program of some kind, or a program that's just within a shelter and they're time limited to typically anywhere from 6 months to 24 months. And the purpose is to get them transitioned into housing of their own. A few subpopulations to highlight within the point in time data, and keep note that these may be duplicated so someone can answer yes to more than one of these questions. But we had 82 that were fleeing domestic violence or reported they were currently fleeing domestic violence, 9 with HIV or AIDS. 576 reported having some sort of mental health diagnosis, and then 480 suffer with substance abuse disorder, either currently or in the past. And they ask that when they ask the questions, if it was a current or something in the past. Some additional data points to note: we had 2.3% that were under the age of 18, so minors. 4.8% of our homeless population were reported to be Native American, which is a huge disparity in comparison to our general population. I think it's at like 0.6% Native American, so 4.8 is a big disparity within our homeless population for Native American folks. Our shelter beds did have a decrease of usage. And we had a permanent housing bed decrease. So rapid rehousing programs, permanent supportive housing, or other permanent housing, which might be some kind of voucher or something like that. Utilization of shelter beds has been down, and the young adult population 18 to 24 has been decreasing. And when we look at the data for homeless services or program utilization in our area, we look at the whole system. We don't look at an individual agency or program, because we want to remember that we're trying to affect the system with the policies, and this has the system working and collaborating together. So ways that you can help: you can have resources like the coordinated entry access point flyer available for folks. Anyone who is experiencing homelessness or at risk of experiencing homelessness very soon can get connected to an access point, and they can kind of help problem solve the situation with them and get them to where they need and want to be. You can contact street outreach. The message line will get them added to a schedule, and the street outreach teams will go out and meet with that person and see if there's anything that they can get them connected to, or any kind of services or basic needs that they have. And then also for rental or other kinds of resources, 211, of course. All right, now it's Lindsay's turn. You're up.
All right. Thanks, Tamera. That was really helpful information, and definitely some statistics I wasn't even clued into. So that's really helpful. Good evening. I'm Lindsay Kroll. I'm the mental health coordinator with the Omaha Police Department. I'm going to share a little bit about our behavioral health and wellness unit and our co-responder squad that we have with the department. It's a newer unit within the police department, really designed to engage with folks with a specialized approach who are struggling with mental health issues, or responding to 911 calls that have a mental health component to that. So it is a multidisciplinary team, including civilian mental health professionals, as well as sworn officers in our unit. And yeah, so we're pretty excited about having this unit within the department. Some of our main goals are really to divert from unnecessary hospitalization, or divert from booking or incarceration for those who have some mental health struggles. As Tamera shared, there is a high overlap with mental health issues and homelessness. So those are a lot of the folks that we end up working with and trying to support to find alternative options to meet the needs that they have. We started tracking kind of mental health related calls for service for the department, just to kind of give you a snapshot of how many calls for service OPD receives related to a mental health issue. Over the years, that number has increased since 2020. That doesn't necessarily indicate a higher likelihood or increased mental health issue in the community. It's really more or less, this is kind of a increased compliance of using the correct disposition when ending their call for 911. So I believe last month we had about 750 mental health related calls for service. So we get a lot of mental health related calls. These individuals are often in crisis. You know, that crisis can look a variety of different ways, whether someone's suicidal or under the influence of drugs and alcohol, or maybe they're experiencing some significant mental health symptoms causing disturbance, or just some other concerning things in the community. So with the Behavioral Health and Wellness Unit, we have our co-responder squad. So these are licensed mental health professionals who are embedded in the precincts within the department. So we currently have 6 of those professionals, 1 in each precinct. And then we do have a youth specific co-responder who responds mostly to youth related calls and really supports our officers in the school system as well. They respond to all sorts of calls for service that have a mental health component. We certainly have a handful of folks that we call our familiar faces that call 911 with some regularity. Often those folks are experiencing some homelessness. What we find is that sometimes folks who have limited access to resources sometimes have cell phones, and those cell phones can call one number, and that's 911. And so that sometimes becomes the number that gets called often. Whether officers are needed to respond in those instances or not, we are helping to kind of divert from having that officer response if we can assist those folks in different ways than having that interaction with officers. The co-responders also do proactive outreach with folks that they have a lot of contact with, or that we know has some ongoing mental health issues. We do that with our core squad. So our core squad stands for Collaborative Outreach, Response, and Engagement. And these are our assigned officers to our unit. We try to respond in a very trauma-informed way, and our officers are dressed in more of a soft uniform, similar to kind of like the polo I'm wearing today. We respond in cars that aren't marked cars. They don't have lights on them and OPD wording on the side of the vehicles. To really kind of give that softer approach when we're engaging with folks in the community. Not everyone's excited to have police cruisers show up to their house and have the neighbors ask questions and that sort of thing. So we try to be really mindful of how we physically present in the community to help folks in a crisis. This is just a picture of some of the team. We've added some folks since this picture was taken. But like I said, we've got a co-responder in each precinct, as well as that youth specific co-responder. I provided a breakdown of mental health calls by precinct, so you can see kind of where the higher call volume lies within the city for mental health related calls for service. Northeast is where majority of the homeless shelters are. So Sienna Francis, the Lydia House, and then in Southeast we have the Stevens Center shelter. Downtown area is pretty much Southeast area as well, a little bit into Northeast. I would say that this is pretty consistent as far as calls by precinct that we see for those folks who have mental health struggles. We do track kind of a top 5, top 10 addresses. And I will say that our shelters, like Sienna Francis, is typically on our top 5, definitely on our top 10 of locations that call 911 for mental health related issues. So kind of makes sense that statistic Tamera shared has that high overlap for mental health stuff. So when we talk about how do we support folks who have a mental health issue, who may be experiencing homelessness, the thing that I always have to remind myself and my team is that we can't always want something more for someone than they want for themselves. And so some of the barriers that we see with really trying to get people connected to resources or services or things that we know will help them reach some stability is really something that we see across the state, is that there's, often a provider shortage within our state, and that's from mental health professionals to peer support specialists to doctors and psychiatrists. Sometimes it can just take a really long time to get plugged into a resource or a service to help someone manage their mental health symptoms. Wait lists are long. Sometimes the folks that we work with who experience homelessness, they're not always super easy to find. You know, they don't have a phone. They're not staying in the same place. And, you know, it's kind of, you think of the Maslow's hierarchy of needs. For me, if I don't have a stable place to live, or I know where my next meal is coming from, getting into treatment or working on stability and sobriety is not really my top priority at that point in time. There's always kind of capacity issues that we see with different providers, bed shortages for more acute levels of care, barriers, of course. Transportation is a huge one. Public transportation is not the easiest thing in our city for folks. There's funding. So, you know, there is funding available. Region 6 Behavioral Healthcare is a great entity and the payer of last resort for a lot of folks who are indigent or experiencing homelessness, who may be uninsured. And then just formal and informal supports for people. I think that there is a huge stigma around mental health, mental illness, folks who experience homelessness. You know, these individuals are typically not violent. Often these are the individuals who are much more vulnerable to experience being a victim of violence or a victim of crime. And so we have that kind of stigma barrier there present for folks who are experiencing those things in life. And I did want to share this too. The Surgeon General actually recently came out with a report stating that isolation and loneliness is actually to be considered a public health crisis. And if you actually read the report, there's a huge overlap with medical issues, as well as, you know, mental health issues that come about for folks who experience isolation and loneliness, which we only saw increase during the pandemic time. So I think it's important to recognize that. I also wanted to share a little bit about the Stepping Up initiative. Douglas County is actually identified as a model county in this initiative. It's a federal initiative across the country, working with individuals who have severe mental illness who experience over-incarceration. And so we actually have a Familiar Faces project here locally, where we've identified some folks who a lot of times are unhoused and have severe mental illness who continue to end up in jail. And we know that individuals who have severe mental illness end up staying incarcerated a lot longer than the other general public who do not have that additional struggle. But with these folks, we are putting in some additional measures to create different case management opportunities for folks who will actually kind of follow them around the community and ensure they are kind of getting their needs met and maintaining a level of stability. So just some cool things that we have going on in the community to address some of the ongoing issues. I wanted to share some additional resources. You know, it's when do we call 911? When do we call for other things? If it's an emergency, a non-emergency, you know, what do we do as a community? So obviously 911 is there for a reason and should be utilized. You know, certainly if there's someone who's acting aggressively, or, you know, it's an unsafe situation with some immediate safety risks, like call 911. Absolutely, 100%. Officers are there and ready to respond and address that issue. If there's criminal activity, all of those things are absolutely appropriate to do that. I also wanted to share the 988 number, which is another federal number that kind of has come about in the last year and took over for the National Suicide Hotline. So you can actually text that number, you can call that number for someone who's in a suicidal crisis, but also experiencing some instability. They'll get connected with trained counselors to support folks. Even if you're calling as a community member of, hey, I don't really know what to do or how to support this person, that's certainly an option, and they may be able to guide you in that way as well. And it's 24/7, just like 911. For other non-emergency related issues, I included a list of different ways to report things through the department. We now have an online reporting system, and we do have our telephone reporting squad that is available to take reports for folks if it is a non-emergency, and based on all those various different types of reasons to be contacting, those resources are there and available to be utilized. Also wanted to highlight, we do have an OPD threat incident prevention system. So that is a way for people to both report anonymously or non-anonymously about some issues or people of concern that they're seeing in the community. And they can kind of be triaged in that way if you're not wanting to call and make a formal report or things like that. So just wanted to make sure that everyone is aware of those additional reporting options for folks. And that's all on the OPD website as well. Tamera, some more resources for you.
Oh, yes. These are just some resources I included. There's a couple of dashboards. You can look at some different numbers, reports, data, statistics that are specific to our area, and some of them you might be able to compare to other communities, to kind of see how we are in comparison. The Housing Narrative Lab here does a lot of work around decreasing the stigma of homelessness and housing insecurity. End Homelessness, that's a National Alliance to End Homelessness. They have a lot of resources for folks regarding homelessness and services, and in general, they're one of the leading national experts in homelessness. The United States Interagency Council on Homelessness, again, they have lots of different resources and statistics available, and they're the lead federal agency outside of HUD that puts out guidance for communities and supports communities. I regularly work with our local usage representative to put together some guidance and things for the Homeless Task Force. Homeless Law is a National Homelessness Law Center. So, if you want to get into specifics about law and those kinds of things, you can look up their website and their initiatives. And then the National Coalition for the Homeless also has a lot of advocacy documents and just some things to kind of help break stigma and that kind of stuff. So if you're interested in any of those resources, go ahead and check them out.
And just to kind of wrap this up, some additional resources for other issues that come about. I think these are really great things to just be aware of. One is the Nebraska Family Helpline, and this is, they promote as any problem, anytime. Again, trained counselors 24/7, resources for parents. They do have an opportunity for kids to reach out as well. They can kind of walk you through any sort of issue you have, maybe with family related issues and kid related issues, but they have a plethora of resources available to them to connect people to. So I've even called them for like a resource recommendation for someone that I've worked with, and they can be incredibly helpful. And that's run through Boys Town here locally. Safe Harbor is also a really great resource that's run through Community Alliance. It's currently housed in the Annex building next to Lasting Hope Recovery, so not too far from downtown. And what it is a peer-run crisis diversion center. So when we say peer-run, these are folks who are working there who have lived experience with mental health, substance use issues, and they are living in recovery and there to support other people's on their journey to wellness. And so people can go there and visit with those peer support specialists. It's not an alternative to housing, but they can stay for up to 24 hours if needed, and receive some additional supports and resources. They also have a warm line as well. So people can call and, if someone's just having a bad day and they want to talk to someone who kind of understands what they may be going through in a different way than a professional, that's certainly an option for people to call and chat with folks. Then, of course, 988, as discussed before, a great new resource for us to have, and you can chat or text to that. I also included my email address and then our generic behavioral health and wellness unit email address. Those are both on our website as well, but happy to triage any questions or anything that comes about as well.
I did want to add, Lindsay, note that when you mentioned Safe Harbor, they do actually have peer support specialists in all of our shelters. And I think they have a significant amount of hours at Stevens Center, but they do have a presence at all of our shelters and work with folks that are staying in the shelters.
That's great. Well, ladies, thank you so much. That was so much information. For those of you that are in the audience, we are going to have a recording of this available. We're going to put it on our website. We're going to, put it out there on Facebook. We also have every single one of these resources that they have provided for us. We also have those listed on our resources page, which has everything from phone numbers for who to call if there's a street light out to direct phone numbers for actual outreach officers that you can speak to yourselves. So as we get into some questions and answers, I want to throw out some ideas. Some of the things that we see, I'm a resident down here. I live in the Paxton. My office is in the First National Bank. So I experience walking through communities at all hours with my dog and see a lot of different kinds of things. So I know that a lot of the residents that have joined us tonight are probably seeing a lot of the same things that we are. And you touched on some of those most important things as what do you do when you come up against a situation that is not right. You try to first evaluate, is this person a danger to themselves or to me? And then to go from there. Is it something that I need to call 911? Is this something that I can actually talk to this person? If it's a situation where someone's sitting out in front of your business or your residential building, or they have gotten into maybe the lobby in the early hours, you need to first and foremost always make sure that you feel safe, and then evaluate if you can deal with the situation yourself. If it's an emergency, if it's not, 911 is always going to be the best option for clearly if there's actually anything going on. But it is also a great way for certainly for the police department, but also for Tamera and everyone else to be able to track what's going on. So the dispatch will decide if it's an emergency or not. So you can call and you can say, this is not an emergency, but there is someone who's been sleeping here all night. There's belongings are all over the place, whatever it is, we just need an officer to come by and check. And generally speaking, those calls will get thrown into the list, and then an officer will come down. And if it's just a situation that someone is sleeping, they might be able to move them on, depending on if they're leaning up against a building or if they have spread out. Either way, generally, the presence is enough to shift the behavior. It's when something is actually scary that we want to make sure that we're getting these resources, knowing what is out there as resources for the person that's actually going through the crisis. So we really want to make sure that everybody has access to all of that and feels confident and knows what they can do. And again, we always get that question, "Ooh, it isn't an emergency and I don't want to call 911. That's good. We don't want to criminalize homelessness. But there is a lot of good neighbor behavior that is expected in an urban area. And sometimes it's a very fine line, what we're seeing. We have situations where we have a couple of people, Lindsay referred to the familiar faces. We've got a group of people whom we know by name. We know what their mental health issue is. We know sometimes they're not a problem and sometimes they're a big problem. And that's when we call 911 and we say, we are having someone who is truly having a crisis, and it is being a public disturbance, and we need you to come by and take a look at that. So again, Christina, I feel like there was a slide in our presentation where we listed some of these resources. We are going to make sure again that everybody's going to have that. There you go. Thank you. This is on our website. We have an entire line that says advocacy for homelessness. Not only does it talk about a lot of the things that Tamera and Lindsay were already talking about, but a lot of the phone numbers that are listed there literally go directly to the outreach officer. And again, these folks usually know the people that we're talking about. Even, they have a group of 50 people that they know by name, whereas I know 5 or 6 of them. So, and these are often truly cell phones that belong to these outreach workers. And some of them come out as soon as they can. I mean, literally 24 hours, they will come right out. It really depends on the officer and what they have going on. But we do suggest you look at these resources, and if you feel confident, taking the time to call one of these officers and asking the outreach officers to come down really is a much better way to deal with the situation than calling 911. if it's not an emergency. There are also situations that we see a lot in downtown where people find their little nook and it's a comfortable nook. And so then they become a familiar face. Maybe there's a spot that they like to panhandle or that they feel like they can be safe and warm. And those can contribute to a feeling of nuisance in an urban area. And it is important to remember that they're not always actually being a nuisance. So it's, it's that fine line. Are they truly disturbing the public, or is it just someone that's sitting there and in the sun and passing the time of day? So there are a lot of things to think about, and we know that it is really hard, and sometimes it feels uncomfortable, and we know. So that's why we're having forums like this, where we want to really put out a whole bunch of information. We do have some questions that we've already gotten. We've already also gotten a couple of questions from this group this evening. I'm going to start with those that have gone into our question and answer real quick, because I can answer them very quickly. The first is, do you cover cleaning and safety in the alley behind the Brandeis building? We absolutely do. We have all 75 blocks of our district. We include going into the alleys. I would remind you that of the 75 blocks that we have, we do only have 3 to 4 people on at any given time. So they have specific routes that they do. They have hot spots that they know that the wind blows trash to, or that we just see a lot of accumulation. So when you see something major, so the question about the Brandeis up there and along 16th Street, we often see large items. We see furniture and things that get put in the alleys. We see people having to use it as a restroom, things like that. So when you see things like that, big messes, we are the people to call. And if we cannot fix it ourselves, we can figure out who can fix it. And big picture wise, when we start to identify places like the spots that we're talking about, those are the ones that we start to focus on. So I'm not going to go into too much depth about all of the things that the DID does, but there are some specific hotspots where we really focus on what can we do. So for example, up there on the 16th Street corridor, down in the Old Market, some of those areas where we have a high volume of residents and visitors, and everybody's living together, from the homeless folks all the way up to the CEOs. In those areas, we have started working on some initiatives where we can improve lighting in the alleys, trying to get some security cameras out there, getting more eyes, working with our private officers and the Riverfront team to really make sure that they know exactly where those spots are, and really encouraging them to pay attention to that good neighbor behavior. And those that are enforceable, then to go ahead and do so, but to try to do it in a way that we're not criminalizing folks. I thought there was another question, but it looked like it got taken out. Christina, I know that we have a number of questions that came in through registration.
If you want to tackle the answered ones too, I know Tamera and Lindsay tried answering some of those, but if they have any additions, if you want to read those, plus then the videoed version will have those answers on it.
I do not have those questions.
At the top, there's open, answered, dismiss. If you click answered.
On question and answer?
Yeah.
Oh, okay. On open, I've got 1. Answered, we've got 7. Okay, thank you, Christina, for always being my brain.
And then the
okay.
answer under it will be in that blue. It'll say show all. So
okay. I might have to have you say that again. So again, that first question that we got in there was about the cleaning behind the Brandeis building. Oh, also for our participants, those of you who have asked these questions, I assume you're actually still with us. If something doesn't get answered with enough detail, please do call the office. I am happy to sit down, even to meet and come look at some specific places that are of concern to you. Please just reach out, because we can absolutely get you more information at any given time. And we do, that is our best advocacy work, is just working directly with someone who's got a question or an idea of a way to fix something. Next question is point in time data for a given day or for a whole year? I'm going to throw that one at Tamera.
Yeah, as I put in the answer, it's for a given day in the year. So the the data for a whole year would look a lot different and have a lot more nuances to it, because you would be counting maybe somebody who entered the system for one day out of the whole year, that they would be counted, and maybe they self-resolved or whatnot. But this is for just any random given day. So all of our bed capacity usually is filled in the winter months. So you're counting everyone in the shelters and transitional programs, and then all of those that are enrolled in street outreach services and doing a street count as well.
Thank you. All right, our next question is, what is the plan for the influx of illegal immigrants for housing, healthcare, education, transportation, food, clothing, all those amenities? And Tamera answered this one as well. I'm going to read her answer and then you can elaborate on it if you need to. We have several community organizations that regularly work with immigrant and refugee populations. We haven't heard of an anticipated influx, but can definitely find out from these planning groups within the homeless services if they have heard anything being discussed recently regarding an anticipated influx. Omaha, one of the reasons that our numbers are low is that our weather is terrible. Our winters are terribly cold and our summers are awfully hot and humid. And it does actually keep people from other locations coming to live with us. We do, however, we're right in the middle of the country and we often see traveling populations that are coming through. Maybe they're going into Denver to get services. Maybe they're traveling to another place. And so we do sometimes see a lot of the travelers, and because we have wonderful services, they do often stop here in Omaha to get services before they're moving on to other places. Tamera, do you want to say anything else about that? And Jill Stover threw a comment on that to say that Governor Abbott is sending busloads. We have not actually heard anything about that being a real thing. So we're very, very hopeful that is just a very terrible rumor that is designed to scare people. That is not true from what we are hearing so far. Our next question, how are 911 operators determining if a call is a mental health crisis? Basically, when you call and you say what's happening, they have a list of questions that they will ask you to get a little bit more specifics. But again, our dispatchers are trained to be able to decide from what you're saying where you need to be on that priority list. If someone is brandishing a weapon or is truly threatening somebody's person, that's going to get shut right to the top. If it's someone who is just sleeping up against a building, they're still going to get added onto that list, but it's going to be a little farther down because the officers are going to have to attend to those first priorities, if whatever the call is. Let me make sure I answered that. We've got a couple of folks who responded onto this, and I'm going to read them in so that we can make sure that everybody's heard. This is from Officer Williams. She's one of our Riverfront Patrol. Good question. Most of the time, dispatchers don't enter the call for service as a mental health crisis. They'll dispatch it as a check for well-being or for disturbances. However, they can use the address or phone number associated with the caller to inform the officers that the person calling has a history of mental health related calls for service. I think Lindsay really alluded to that. We do have a lot of folks that call 911 when they are in a mental health crisis. Sometimes the caller will state whether it's a mental health crisis or not and request the crisis intervention trained officers. We've certainly done that ourselves. Officers ultimately themselves make the determination when they get there about whether the call will have mental health or a mental health designation. And our officers are all trained to make those designations. And even if the call that they're responding to doesn't sound like it's going to be that, when they get there, they have a couple of things that they're going to look for to be able to say, ooh, maybe I'm not even safe going up to this. So, and Lindsay also said, thanks, Officer Williams, that's correct. Depends on the information that's shared with 911. Co-responders have access to all of those calls, and they can also help make the determination to respond, to assist or not. Also remember, I think Lindsay touched on the fact that the co-responders and their core team, they don't just respond to calls. They do also work with the individuals that they have met with before. So they are half emergency response and half ongoing caretaker. So that's probably not the right word, but Lindsay or Officer Williams, if you have anything else to answer, please throw in. All right. Let's see. Question, can we elaborate more on the transportation barriers? So Lindsay responded, there's often resources available, but they may not be easy to get to if you don't already have a vehicle or the funds to support transportation. So what she's alluding to is our bus system is the easiest way for people to get around. It's the easiest and the most inexpensive. Unfortunately, it lacks going into absolutely everywhere that we need to get people. Maybe someone's been hurt. Maybe they are so far away that they don't know how to get there. And maybe they literally don't have a dime to their name to be able to pay for the bus. So that's where we'll call Sienna Francis House and ask them to come pick up someone. We've got a number of shelters that have a program that have vans that can go around and pick up people. Open Door also does, and each service provider has different requirements for who they pick up and where they will take them and what kind of services they're going to provide. Do you have anything you want to add to that? All right.
Oh, you're doing great, Holly.
Cindy, this is exactly the question that I was referring to a little bit earlier. Someone left an old couch in the alley behind the Dubliner, and a homeless man has made it his home. We will get out there and we will pick that dumpster up. That is an example of when you see something like that, whether you're a dog walker or a resident, or like me, I'm a pedestrian and a pedestrian commuter. And so I cut corners all the time and I go through alleys to save 30 seconds. When you see something like that, call us because we don't always see that on our regular routes. We are hitting our hotspots and a couple of other things. And sometimes these things are back there for a couple of weeks. So we don't want that. The first time you see it, please give us a call. We'll have our guys come out and get it. So Cindy, thank you for letting us know. We'll get someone down there and get that removed. Let's see. Where's my next one? Oh, this is a great one. What specific things are you doing to reduce the number of homeless veterans? And Tamera answered that question. There's a community group really digging into this data and policies for the homeless services. It's called Built for Zero. There are some very specific federal benchmarks that a community has to report to declare functional zero for any homeless population, which would be absolutely phenomenal if we could get to that. Functional zero being not completely zero, but a system that has less entering and more leaving the system each month. So we've heard a lot tonight about some chronic homeless. We've seen the numbers of the folks that we have. It's less than 200 people that are truly living on the streets. And those are the folks that we really would like to get into transitional housing. There are a lot of folks in that particular subgroup that don't want services. They don't want to go into housing. They want to live on their own. They want to take care of themselves. There is a huge system distrust that either they have been hurt, maybe not by a provider, I would assume, but something happened to them in a shelter, something happened to them with a caretaker, and they're afraid of the system. So functional zero refers to the fact that we are never going to have a population where there is not one person living on the street. There will always be a few folks out there, and the goal is to help as many of them as possible to get out of that situation. And for those that are staying in it, to be able to make sure that we keep them healthy and safe and living the best lives that we can. Tamera, do you have anything else you want to throw at that?
I don't think so. I think you did a good job. I did want to note that for Veteran Functional Zero in the United States, the United States Interagency Council on Homelessness has been working with communities for, I would say, about 4 or 5 years on those benchmarks. And 2 states, Nebraska and Minnesota, have not fully declared functional zero for veteran homelessness at some point. And Omaha, the balance of state and Lincoln have both declared functional zero for veteran homelessness. So We are trailing behind here in Omaha, which is fine. I think our local VA does a really great job with housing and supportive services for veterans, but we're just trying to work together to collaborate more and really organize the data that we have so that we can submit the numbers and everything that the federal government wants, so we can declare that.
It'd be great. It'd be really great.
I do have a couple of questions that were submitted on our registration. So a couple have already been answered, but I do have a few that we haven't touched base on. A comment and question: the homeless matter is an Omaha issue that we all should collectively address and support. My question: what responsibility do shelters have to their neighborhoods with the impact they have on area businesses, tourists, and residents?
That is a fantastic question. The shelters are treated as a business, and as such, we, the city, the improvement district, wherever those shelters themselves are located, they are required to maintain their property the way we require our businesses to. So that means that they have to keep their litter picked up on their sidewalks. They have to keep their plants and trees and weeds under control, their property well maintained. We realize that is a really that stuff kind of falls to the wayside, and that the issues that the neighborhood's seeing as an impact are more the people walking, there's a large populations. The shelters open in the morning and everybody floods out, and then in the evening everybody floods back, and those are the kinds of things that the businesses and residents that live in those neighborhoods, you're going to experience that every single day. Those are the kinds of things that sometimes that we play a little bit of advocacy or devil's advocacy on, where we say they are vital parts of the neighborhood, and so are you. And we hope that you can develop personal relationships with the employees at the shelter, maybe even some of the folks that live there in and out, so that it becomes less difficult for you and for them to coexist. When we're talking about making sure that they're maintaining the property, that is absolutely one that we can come through. Perhaps it's something that we need to have more trash cans out on the periphery, so that as people are walking away, they have somewhere to throw litter that's not right there in the shelter. Those are the kinds of things that the DID can help with. So again, asking our constituents to call and let us know what kinds of specific issues you are seeing, so that we can then go back and work with the shelter as a property, with outreach officers, maybe trying to figure out some better routes. We also, one of the things that I do regularly is talk to the van drivers at Open Door Mission, because they have a couple of spots that they typically drop people off, and they have a couple of criteria for why they drop people off there. And generally speaking, it's because it's an intersection that is central enough that the people that they're dropping off can get to a day's job or finding access to a computer or whatever it is that they're coming into town for. It's also usually an intersection that has a big wide sidewalk, which is a safe place to drop a whole group of people off at one given time. And it's usually a place that's pretty visible, because the whole reason that they are bringing people into certain places is to raise awareness of the fact that this is happening. These folks are homeless. This is something that's happening, and it's kind of a little under the table marketing for them. So if you are having an issue with something like that, sometimes we've got a van dropping some people off or picking some people up in a place that is just not safe, whether it's because of traffic or for something else. Let us know, because those are the things that we can absolutely work with the providers and with the community itself on. Okay, next question, Christina.
We had a question about how full are the two main shelters, Santa Francis and Open Door Mission? What can be done to help keep homeless from sleeping on the sidewalks downtown?
Well, that's another really good one. And I'll let Tamera, you might be able to answer the actual beds.
Yeah, I was gonna say, on the last question too, I mean, the shelters being businesses, right, and having to take care of their property, and they know this, but knowing that they are kind of in a very unique position of of providing services to people too, and not wanting to create additional harm for them, right? So trying to navigate those specific things. And also, you know, once people leave their property, they're not really their responsibility anymore, unless they're on their property at their shelter. For system usage, as I said in the presentation, the shelter bed utilization has been down. So thinking of the whole system, so not just our two biggest shelters, but overall our utilization is down. I believe in 2022, it was around 86%. Lots of reasons for that. I've talked with several different shelter providers to find out, you know, we're not at capacity. Some of our shelters might be, but not all of them are, for various reasons, including a big one that I've heard is accessibility. So folks that maybe have pets, that it's really hard for them to enter a shelter and they don't want to lose their pet. And also if they have mobility issues, all of our bigger shelters have bunk bed style beds. And if all of the bottom bunks are filled and people needing to get in cannot get on a top bunk, then they just simply can't access shelter. They have to stay on the street.
And we know that we have a group of folks that sleep there. There's a young man who sleeps across the street from our building almost every night. You know, as the weather gets warmer, we start to see more of that because it's easier. Again, those are the kinds of things that they're not an emergency, but there are times that they just need some presence to be able to remind them, hey, it's time to wake up and move along. You can't live here. Sometimes we ask the property owners, and again, this is one of those, if you feel confident, and often these folks are familiar faces at that point. So you might know their name. You might be able to take them a cup of coffee and say, this is it. This is the last time you can't be sleeping here. You cannot set this tent up. Those are the kinds of things that we will call 911 on. And sending outreach officers out. I think the other part of that question that's really, really tough is that people do not have to accept services. We can send an outreach officer, we can send a police officer, we can do whatever we can to offer a helping hand, including a ride to a shelter. And if they say no, we're pretty much obligated to leave. The only time that we would not leave would be if someone is actually being a danger to people around, to themselves or to people around. And that's when we would absolutely make sure that the police are involved and that their co-responders are right there at helping with the situation.
And we've mentioned too before about making the space activated kind of helps naturally deter that as well.
Yeah, thank you, Christina. There are a lot of quote unquote passive activation techniques that we can use. So first and foremost, more people on the sidewalks, getting more people down to events, coming out for restaurants and enjoying themselves. Active spaces are not places where the homeless community wants to sit because it's not comfortable for them. So places that are having concerts and outdoor music, lots of lights, that kind of stuff. Those are the kinds of things that we often encourage businesses to do. Put security lights in, real bright security lights in those little nooks that are right there, and that is not somewhere that someone's going to want to sleep. And again, having business being active, having things happen, all of those kinds of things. Those make it so that those are not places that people want to stay. We are always going to have some folks that is the best place that they are going to get services, whether it's through panhandling or anything else. So again, I would remind you that we have very few, 160, I think, was actually unsheltered. And of those folks, we know of so many of them by name. It sometimes feels like a big, huge problem, but I would remind you that we are so lucky when we look at other cities like Portland and Denver, even Washington, DC, where where they are seeing literally hundreds of thousands of people sleeping in tents in the parks because they have nowhere else to go. We do not have that. Again, I don't know if we should be thanking the weather or not, but we don't have that. So it is easier for us to take care of our people because we don't have as many. What we really lack are more people that are actual service providers.
I just have a couple more questions, and I'm going to kind of group these a bit together. It says continued harassment from homeless and pandering every day, multiple times a day, best solution. And then I'm also going to tie in penalties for public defecation and indecent exposure. Those were some questions.
Perfect. All three of those things that you mentioned are actually illegal on the books and enforceable. Those are 911 calls. Aggressive panhandling, absolutely on the books. Going to the bathroom in public or being inappropriately dressed, doing inappropriate things in public, those are illegal. Those are absolutely 911 calls. Those are easily enforceable. And when you say what it is, they will respond immediately. Now, the one that I'll address a little bit further is the going to the bathroom in the public. We don't always see this happening. Sometimes we just see it afterwards. Unfortunately, you can also call my organization. My team can come down. We really don't like doing that, but we know that you don't want to either. And that's the kind of thing that if we see, we need to get it up immediately because it's a public health hazard. So if you see someone doing that, if you can surreptitiously take a picture and call 911, and they will tell you how to send that cell phone picture. Again, most of these folks are people that we know by name. We can look at the picture and go, oh my God, Joe again. And then they can go out and they can actually talk to Joe and get a hold of him. Obviously, that's something that we ask you to do only if you can feel safe doing it. We do have one property owner who has a real nice little potty in the back of her space. It's just a perfect little nook and it's real easy for people to get in, and that's a little bit hidden, but it's right by her door. And she has taken to literally walking by while it's happening and saying, I can't believe you're doing this. I'm taking a picture, and they, look right at the camera and we have actually seen a decrease since she has started doing that, because we can send a picture to the police and they go, oh God, I know who that is. So, so we do highly recommend. I know that that's really not the most pleasant thing to do, but that one in particular is a real hard one to actually catch in the act. But all of the others that we are talking about, you call 911 immediately when someone is actually breaking the law. It doesn't matter if it's a security issue. If they are actually breaking the law, those are enforceable.
We did have a comment about concern with the bodega on 16th and Harney having the ability to sell single cans of alcohol.
That's a great question. And this is one that we actually see in a couple of different places. We do have a state law that allows liquor stores, gas stations, anywhere that has a liquor license to sell alcohol cans and those kinds of things in individual portions. And because it's a state law, it's not going to be something that that's going to be very difficult to change just for a couple of locations. That specific location that we're talking about up on 16th Street has been connected to a couple of different issues. That one is on a case-by-case basis that we can go to the State Liquor Commission and say, this particular practice is not working in this location and they are abusing this, and we need to modify their liquor license. We did it a couple of years ago, and they modified for a full year, and it did make a huge difference. We also went in and changed a bunch of the streetscaping and changed the environment so that they weren't having people go in, buy a beer, and then come out, and we had provided lovely benches for them to sit and drink and then go back in and get another one. And we hadn't provided trash cans, so they would drink it, throw it on the ground, go back in, get another one, and then come back to the bench. It was brilliant, streetscaping. So we changed all of that, and it sort of changed the behavior. But obviously, if we're getting the question, we are still seeing those kinds of things happening. And we do see that in a couple of other places where we have single unit alcohol available. Again, it's a state law, so it's going to be a real hard one. But I would also say I hope that whoever asked that question is still on tonight. If you can call the office and give me a few more specifics on what you're seeing, we can again go back to the city attorneys who deal with that and say, hey, we're seeing this again. Cindy has raised a hand. If you have a question, Cindy, if you could throw it into the Q&A, that would be the easiest way we can answer a question.
And then lastly, just interested in the library changes and its impact on the situation.
Oh, that's actually a really, really great question. The old Dale Clark Library was sort of an ipso facto day shelter. First and foremost, libraries are always sanctuaries for people, and that is not going to change. And we don't want it to change. It's a place where they can get out of the elements. There's often power plugs and things that they can charge phones. And it's an intellectual sanctuary that will always be there. We are probably going to still see the homeless community using the library, the new library. However, its new location being far enough out of walking distance from the shelters, it's just on the edge of the comfort level that people have of walking to places, and it's no longer connected to the park. That was one of the other things, was that not only was there a place that they could get inside, but then right across the street was a public space that was beautiful and comfortable and had space for them to spread out. The new library doesn't have those kinds of options. So like we're talking about with activation, if the goal is to create spaces that are I don't want to say not welcoming, because that's not the words that we're looking for, but that are decreasing the behavior of the not loitering, the sitting and staying for hours with your belongings surrounded, or literally sleeping. The new location is not nearly as conducive to that. So I think that we will see a little bit of a decrease. However, we are always going to be monitoring that situation. The library staff are also really, really well trained in being able to identify the folks that are in their building and what kind of behaviors they're seeing and familiar faces and things like that. So they will continue to do that, and we will have our presence out there, our security presence, certainly. But the new location, the other benefit that it has is that it is surrounded by some residential buildings. And so again, those are we really rely on the people that are on the call tonight. If you see something, call 911, call us. Help us figure out what exactly the situation is, so that we can get in and figure out what resources we need to put at it. So it's going to be a little bit of an organic process as it opens. Probably this first year, we'll really be looking at it to monitor to see exactly what behaviors we're seeing. But I do think that we're going to see a little bit of a decrease of the usage that we used to see at the Dale Clark Library.
And just to add a point with that, we've talked with Mecca and their public space. I mean, they say everyone's welcome in their space as long as they're using it appropriately. So, I mean,
yeah. And they have a private security team that is down there at any given time. They also have been given all of the resources that our officers are given. So they know the outreach numbers to pass on. And they're also trained, again, to really pay attention to that gray area. Is someone just sitting and enjoying the park? Or is someone sitting and enjoying the park and abusing it by drinking or actually doing something inappropriate? And inappropriate would be defined like trying to set up a tent or doing something that is literally against the law. Those are the things that they're going to go in and they're going to say, I'm sorry, you can't do that. You got to move on. And the park does close from 11 p.m. to 5 a.m. No one, not even me, is allowed in the park in those hours. So that is another thing. Also, the new design of this park and the riverfront parks that are opening, they have been designed to have a lot more transparency. And if you remember, the old park was so beautiful, but it literally created a grotto that was very, very dark and had lots of lovely hiding spaces. We are not going to have that. So the tiny encampments that we used to see in the park, they were not major, folks. We were only seeing a few people that were truly utilizing the park as their home. We're not seeing that now. They have really changed the park design itself and the private security and the lighting and all of that has really made it so that that is not a comfortable place for people to sleep. They are finding other places. So, you know,
And
those are, go ahead.
Oh, I was just gonna say, just if you have any issues, again, Holly mentioned our number. You can also email us if you have pictures you want to include, info@omahadowntown.org. I put that in the webinar chat along with that link for the resources.
Yeah. So please do call us, send us pictures. If you're frustrated, if you're, you know, if you're scared of something, let us know. And we can help you determine what is really an emergency, or what is something that's a chronic issue that we need to address, or that we need to pass on to our experts here and say, hey, this is a big picture issue, and we're really running up against this. One of the things that I always like to say, and I do like to remind everybody, that we all live here, whether we actually are paying to live here or not. And we want to be compassionate to everyone. We do have very few actual folks living on the streets, and we know that it is not pleasant sometimes to step over and around them, but to try to come at it with your most compassionate hat on at any given time, because not all of them are experiencing mental illness, but a huge majority of them are. There are reasons that they are on the street, and it's not usually that they don't want a job. It's that they literally can't get and hold one. They don't have a family support system. There are all sorts of reasons why they are out there. And if we can figure out how to make it comfortable for them in the system to stay in the system, then we can get them help. Otherwise, we are their first line. So, Tamera, Lindsay, do you have anything else that you want to add? No. Do we have any of our officers, either our frontline folks or any of our riverfront patrollers that are here that want to say anything? Can throw it in the Officer Williams has raised her hand. Can we give her a mic?
Yep, she's allowed. Go
Hi.
ahead.
I don't know if you guys can see me or not, if the camera is activated.
It is not just voice.
Okay, fantastic. I'm joined by Officer Schuster and Officer Mraz too, and we're all part of the Riverfront Patrol. So we just had the pleasure of meeting Tamera this past week, and we work with Lindsay and the other co-responders a lot. The co-responder for the downtown area is Elisa Limoges, and she works out of the Southeast Precinct. So if you ever need to get in touch with her, we can definitely hook you up with her as well. I took a few notes, and I think you guys hit on a lot so far. We just wanted to say that if you do need to call 911, please do. I've had in the past some business owners who are hesitant to do so, but if you need an officer present, it's the best way to get us there in a timely fashion. We do not see that as a nuisance whatsoever. It's our job. We'd be happy to respond. If you witness something, please give a physical description of the person, what they're wearing, what they look like, how old they are. Things of that nature can help us locate the person or suspect pretty easily and in a timely fashion, and can be shared over radio traffic. If there's a situation that can't be rectified by the means that have already been described in the meeting thus far, we just ask that you call the mayor's hotline, 444-5555, and that office can get you to the right place and the right services. That came to mind when we were talking about the blue couch that's in the alleyway. So if you can't get the hookup immediately, please call the mayor's hotline. We also ask that if you call 911, that you please leave your contact information with dispatch. It's the easiest way for us to get in touch with you as a witness or as a victim. Some crimes have to be have to be initiated by a person that we label as a victim in the report. And if we don't have a victim, then we're not able to go through with an arrest in some cases. So we do need a victim, and it's helpful to have somebody that we can call and ask questions to as well. If we do see anybody experiencing homelessness in the downtown area, Officer Schuster and I will a lot of times introduce ourselves and try to hook them up with resources if they're interested in getting resources. And then we also have a list of familiar faces that we know and get to know through our work. When we're interacting with those experiencing homelessness, we obviously have officer discretion. A lot of times we're going, if the need arises, we're transporting them to a hospital, to Safe Harbor, to Lasting Hope Recovery, or calling a crisis co-responder. So whoever's on duty, if it's the Southeast Precinct one, or if we need to call in, we can always call in a therapist. And they are available and accessible to us 24/7. So those are the issues that and the things that I want you guys to be aware of. Also, just a quick anecdote, Officer Schuster and I were partners. We responded to the Old Market Passageway several weeks ago, and we encountered a man who we couldn't tell if he was mentally ill or substance dependent, and he was having a crisis. He was picking up a garbage can in the passageway and using it to cover his head, and was generally acting disorderly. Instead of taking him to jail for disorderly conduct, which we could have done, we made the decision to transport him to a hospital because he was unable to care for himself. That meets our emergency protective criteria, and we're able to intervene in that manner as well. So do you guys have anything you want to add?
With buildings downtown, a lot of the residents live in secured apartment buildings. If we get called to your apartment, if you call us, we have to be able to get into the apartment. So if somebody can let us in or be ready for a call back from 911, or possibly one of us calling your number from a phone you don't recognize, just to tell you, hey, can you let us in the building? Because otherwise we are not able to get in.
We often block our phone numbers, not because we don't want to talk to you in the future, but because every time you call 911, you're going to get an individual unique officer, and we don't work 24/7. And so I don't want to receive a call back when I'm trying to sleep at 10 a.m. in the morning. So we are the evening crew. We work until 3 a.m. Do you have anything, Officer Mraz?
No, I guess I would just like to say that I'm born and raised in Omaha, and I think that our Omaha downtown district is small, but it's still very comparable with some of the better ones in the United States. If it was large, I think it would be one of the best ones. I think we do an excellent job downtown at running it, and I love it down there. I treat it like my own area because it is, and I love working down there. But I thank you guys for working with us and addressing these situations.
We thank you too. Sarah, my assistant, sent me a message that said you're going to be a panelist next year because you're fabulous. So just be forewarned. Also, Officer Williams, that's Sarah. Officer Williams brought something up that we did not touch on. There are some things that you can do when you have people who are regularly coming and misbehaving at your space. So we talked about residential buildings. So for example, the Paxton has a little vestibule that is heated and is well lit, and it feels really, really safe to folks when they are trying to get out of the cold. They're not allowed to be in there. It is trespassing. And I am usually up at 5 a.m. with my dog, and I'm usually the one that runs into them. I do usually know these folks by name because they are the same people. They know how to get in. They know where it is. And they also know when I'm getting up, and sometimes I see them leaving as I'm coming down. So there are a couple of folks that when they come in, they do bad things. They either go to the bathroom in the corner, or they just leave a whole bunch of a mess. When Officer Williams was talking about meeting a victim, I have done a couple of ban bars on some folks that are regularly coming in and they're not just coming in to get warm. They're coming in to do things and then they leave it behind. So to do a ban bar, to be able to execute that, the police officers literally need someone to say, this is my space and I don't want this person in here. So I have to be present when I ask them to do a ban bar. I have to be able to fill the information out. My name is on the form. They do give the person receiving the ban bar a copy of it. You can have your name taken off it if you really want to. But the officers do need that quote unquote victim. So if you're a business owner, or if you are a residential property that is experiencing something like that, you have a regular person that, you know, this is the 5th time I've seen you this week. This is not cool. Call the officers, get them over there, say, I want to do a ban bar. It takes about 15 minutes. The person doesn't necessarily get arrested for anything. They're not being criminalized right then and there, but they know that if they come back and I have that ban bar and I call the police again, that's when they're going to get a citation and when they're going to get taken away. So Again, those situations that I'm running into, only once or twice have I run into someone who's actually had an issue that I was afraid to deal with. Otherwise, it's just oh my God, Valerie, you can't be here. You gotta leave. So when you get to that place that you can be confident actually working with folks yourself, it's a good place to be able to work with them. But that's when you do want to call 911, is when you've got someone that's doing a repeat, or when you want to actually take action. And the Bannon bars are pretty easy to do, and they're real effective. And Valerie, who I mentioned, I have not seen her since I did it, and I felt bad doing it, but she came in 10 times in 2 or 3 weeks. And so we have all of that information up on our website. And again, we're going to send this out. We're going to have this recording available for anyone that is interested. And if we didn't answer a question tonight, or if you have another security issue that has absolutely nothing to do with homelessness, we know we always have that. We're a city. Please call us and ask us what we're doing, what you can do, and how we can help all of us make downtown even better than it is. So I think that's it, unless anyone has any last minute anythings.
Thank you, everyone, for your time. We definitely went over, which was lots of good conversation. So.
Yeah. Thanks for staying with us, those of you who are still here. So we do these every year. We do different topics every year. Sometimes it's working specifically with the hospitality and service industry. Sometimes it's regarding a major issue like this. Sometimes it's a reaction to a couple of things that have happened. Neither here nor there. Whatever is happening throughout the year, we will talk about that most. And we do usually do these in the spring, and you can always find out about them through our newsletters and on our website and Facebook and so on and so forth. I think that's it. Okay, well, thank you all. Have a good one.